Okay, we're back. Hello. I apologize for stopping it. It just makes it easier for us to have clean recordings that we can post. Thank you all for joining us for today. I'm going to share my screen really quick so you guys can see. Here are our social media platforms. I'm going to share a PDF in the chat with y'all. So that you can copy and like click into these links so that you can join the Facebook group, join our Slack group. So I'm going to put that in here right now. We really love social media here at Lenox Hill. I think it's a great way for us to share our culture, to connect with students, share about educational opportunities that are happening within the department. So be sure to follow us, and we're going to definitely be sharing. Let's see, here we go. Here's the PDF. So I shared the PDF there so you guys can easily click the links. But again, this is a great way for you guys to just stay in touch with us so that you know what's going on in terms of BRAINterns. Try clicking it again. And then we're going to finish today's webinar with a talk from Dr. Netanel Ben Shalom. I have to help him copy invite link. I'm just going to help him get back in. All right, so I'm just going to send him the link. Boom. All right. And I'll go back to this slide. So again, here's our LinkedIn URL. You can follow us on LinkedIn, and that's where we post more information about job opportunities that are happening at Lenox Hill Neurosurgery. So if you're interested in, let's say, that clinical research fellowship, if you're done with med school and you're taking a break between residency, or you're done with undergrad and you're taking a break before med school, that's a great opportunity to get some research experience. I have posted the Slack URL here, as well as our Facebook group, so you can stay in touch with your fellow BRAINterns, as well as our Instagram Threads. We're now on Threads, the new Twitter. We're still figuring out how to use it. So if you guys have any advice, please let me know, because I feel like I'm an old folky here and I don't know what I'm doing on Threads yet, so you can share your advice. We're also on TikTok and Twitter, which let's see how much longer Twitter lasts, but yep, so you can join Slack if you click on the PDF, and you can click the link to join Slack. All right, I'm going to stop my share so I can see. I'm going to make sure Dr. Ben Shalom can join. Are you able to join? Oh, it says expired. Oh, open. Well, dang. Let me post the link in the chat. Make sure you guys can join. I'm going to post the link in the chat. Thank you for letting me know. All right. How are we enjoying BRAINterns so far? I would love to see the chat blow up if anybody has opinions. You're loving it, lots of fun. Love it so far, very informative. Yay, yay, yay. So happy to hear that. Let's see. All right, we're having some Zoom tech issues. I apologize, but we're gonna get it resolved. Okay, let's see more. Right. Okay, let's see. All right. All right. Oh my goodness. I'm so happy to hear you're loving it. It's from Guadalupe Pagazzo. This is your fourth Brain Turns session. Thank you so much for joining us for 4 years in a row. Yes, I will repost Dr. Ullman's, Dr. Galad's, and Dr. Multivoya's links or emails, sorry, here in the chat to make sure that everybody can connect with these incredible neurosurgeons. This is, truly a privilege for us to be able to facilitate this educational webinar for you guys. And we're very passionate about helping the next generation of healthcare professionals. None of our surgeons were able to get here by themselves. There were, lots of mentors that helped them along the way. So we feel really privileged to be in a position where we can offer mentorship and assist you along your own healthcare career journey. So thank you all again for joining us. It really does bring us so much joy to be able to share this information with you. Yay, I was so excited. Gracia Escoval, it's her 4th year. I'm so happy to hear you're back. Also Erica Gress, it's 3 years for you. Thank you for joining us again. Still trying to get Dr. Ben Shalom in the meeting. I think he clicked his link and it expired. So gotta love Zoom. It's always super special. But yes, in terms of certification, yay, Naughty's here. There he is. Look at that background. But in terms of the certificates, I've been getting lots of questions about that. We're going to send one singular survey at the end of the Brain Turns webinar series on Friday, July 21st. At the end, in that survey, you can indicate if you would like us to generate a certificate for you. If you indicate that we would like us to generate a certificate, we will get that sent to you. Unfortunately, we are no longer able to generate certificates for Brain Turns Past. So if you did not receive a certificate from Brain Turns Past, we apologize. We're not able to provide that with you just because it's been, there's been a lapse in time. But for this year, be sure to answer that webinar or that survey for the webinar. Yay, so happy. We have some first timers here and so glad that everybody's enjoying the webinar. Again, we are going to be posting all of the recordings on our YouTube channel. Now that we have Dr. Ben Shalom here, I don't want to waste any more time. I'll stop vamping. Hi, Naughty. Thank you so much for joining us. So Dr. Ben Shalom was actually a fellow here at Lenox Hill Neurosurgery. He was our neuro-oncology and skull-based fellow. And then we were so impressed by him that we asked him to join our team of attending neurosurgeons. And he, since January 2021, has been a full-time attending neurosurgeon at Lenox Hill Neurosurgery. And Dr. Ben Shalom is going to be speaking about global pathways to medicine and his experience training around the world to become the neurosurgeon that he is today. So without further ado, I present to you Dr. Netanel Ben Shalom. Thank you so much for joining us.
Thanks, Hannah. Thank you so much for this beautiful introduction. And hello, everyone. I see 217 participants. Is that right?
218.
Wow, nice. So I think that we're going to have few talks during the course of your Brain Turn programs today, tomorrow, and next week. So we're going to see each other a lot. And what I want to do today is give you a quick and brief introduction to who I am, my background, and essentially how I got to be an attending here at Lenox Hill, and my journey. Hopefully it will inspire some of you, and it's going to lay the foundation for you to have more questions. I think that BrainTurns is an amazing platform to engage in open discussion with people that you consider hearing from and you care what they have to say. And I think it's a great opportunity for us to present what we do and for you to sort of engage in a more informal conversations and questions. So I'll start by sharing a little bit about me about my story. How did I get to where I am today? And hopefully it will engage your interest to ask some more questions in our upcoming talks. As Hannah said, I'm a dual fellowship trained. I did both training in neuroplastic and reconstructive surgery and in neurosurgical oncology. Excuse me for a second.
I also want to thank Dr. Ben Shalom again for joining us. He has a full clinic today, so he's been so kind in offering his time, and we just want to thank you again for joining us.
Thanks. Sorry about that. As Hannah said, it's a full clinic day, and I'll try to navigate. So let's go on. Basically, as I said, I have two hats and two fellowship trained, one in neurosurgical oncology and one in neuroplastic and reconstructive surgery that was done at Hopkins, but we'll talk about it tomorrow. The one and maybe one of the most important things that I would teach you, and this is sort of one of the only things that I would want you to remember from this talk, is if I have seen further is by standing on the shoulder of giants. Basically, no matter where you are in your life right now, and no matter where you want to be, you should really look up to people that should push you and give you all the support you need to get there. I was privileged and very fortunate to have amazing mentors that pretty much polished and made me who I am. And those are just a few of them, which I'm going to talk about later. And I would say that one of the most important lessons is find good mentors. Mentors can be people that you know, people that you don't know, people that you look up to. They can be alive or they can be dead. It doesn't matter. You need to find mentors to sort of gauge, show you the way, and help you navigate through your decisions. I was very lucky to find all those amazing mentors, which you'll see. I'll introduce some of them. My training is international, as Hannah said. I was born and raised in Haifa, Israel. I went to medical school in Hungary. Then I went to do my first internship in Israel again, in Tel Aviv. Then I went to do my first year of residency at NYU in general surgery, where I met one of my first mentors. After I did my NYU general surgery residency, I decided I don't want to do general surgery anymore, and I fell in love with neurosurgery because of one of those mentors that I'll talk about. And then I went to Sweden, to Karolinska Institute, which I knew some people from my med school, and I joined them for a year, learning more about neurosurgery and actually being a resident there. Actually, they have a pre-residency position, and this is what I did for 1 year. After I decided I want to continue and be a neurosurgeon, I finished my training in Israel. And then I went back to the US to do multiple fellowships in UT Southwestern, Johns Hopkins, and Lenox Hill. So the skills that I thought that you need to have in order to become a neurosurgeon are not only surgical or clinical. I thought you should have a lot of other different skills and skill set. And some of them are lying out there. You should have good situation awareness. You should have amazing operating room etiquette. You should have leadership principles. You need to know how to make decisions under stressful situation. You have to have a good emotional intelligence, and you have to know how to manage stress and burnout. And all those things you sort of learn along the way, and nobody teaches you that in med school or residency. And those are some of the things that I was looking for in people or mentors when I was saying, all right, I really like that place or really like that new position. Can I learn those different things from my surroundings? And it's not before I came to I came to one of my last fellowships that told me it's not about your physical surrounding, it's about your spiritual surrounding. And being surrounded by spiritual surrounding, it's like a fish tank, right? When a goldfish is swimming in a little fish tank, it cannot get bigger. But when you put a goldfish in a large tank, they can get bigger. And this is what turned me, as you said, on the right side. This is me going to first grade in a private school in Israel to being a chief resident. Those pictures were taken almost 30 years apart. I was I was going to a private school in a little town in Israel called Haifa, and I wasn't the greatest student. Actually, I had an ADHD that was unrecognized, and I wasn't excelling in school at all. I was struggling a lot. And 30 years later, I found myself in a TV show broadcasting to the entire nation on how am I dealing as a chief resident in Israel, and I'll talk about a little bit. As I said, I grew up in Haifa, which is not a small town, but very beautiful, very famous for its scenery. And I didn't like to go to school. I loved, surfing. I loved skating. I loved going to scouts, and I loved playing guitars with my friends. And it's kind of different these days. The reason that I wasn't good at school because I just wasn't diagnosed with attention deficit disorder, and school was not interesting for me at all. I didn't like studying at all, and I found myself happier engaging in social, situations and going to the beach, and that was sort of what shaped who I am today. Until I joined the military, and in Israel, at the age of 18, you have to join the military. And early on, I remember that I always had a bug that called the medicine bug. I loved medicine. I loved saving lives. And I loved actually transitioning this ADHD when you're all over the place to one single spot, which is medicine. And I started by volunteering in the EMS services when I was 16 as a medic. And then I joined the military. And in the military, you can sort of decide where you want to go. You want to go towards more intelligence and more background, or you want to go, down to be a fighter. And I decided I want to go and be a fighter, but I wanted to do that with another training as a paramedic. And basically, paramedics in the military was a kind of new sort of discipline. It started 3 years before I joined, and I said I want to be a military paramedic. What it means is that you are the expert when it comes to emergency, ACLS, ATLS, PHTLS, and basically you are first on scene giving medical assistance to basically whoever is needed. And it was a 1.5 year training, which we kind of learned a lot. I was 19 when I was done with the training, or 19 and a half, and this is where I joined the Special Forces. In the Special Forces, back in my time, there was a lot of war going on, and during that war, I had to see a lot of terror attacks and massive trauma and mass casualty attacks. And this is sort of what shaped what I wanted to do. And those are some of the pictures from, how I was dealing with, both civilian and military situations as a combat paramedic. Once I was done, I knew that I wanted to do medicine, and I went to study medicine in Europe. The reason I wanted to leave the country, it was a little bit too much. After the 4 year of military service, I needed to clean my head and start fresh. And I went to Hungary, which is the center of Europe, to study medicine. It's a 6-year program, and I loved it. It was very stressful, very difficult. After the first 2 years, I told my mom that it's not for me and I wanted to quit. But then I graduated essentially summa cum laude, which is the third best. I was the third best student in my class out of 700 people. The reason I think it was so good and I was excelling in med school is because I shifted my attention into studying everything. And since I wasn't a good student in school and I didn't have good grades at all, I was kind of anxious when it comes to med school, questioning myself, how am I going to do this? Will I be able to succeed? But I loved it so much that I was really studying day and night. And when it came, from a spot of passion and love to the subject, this is why I graduated the highest score in my class and received the greatest honor from the dean. And med school was a lot of fun. It was a lot of studies, as you see on the right lower picture, but it was a lot of fun. We lived in the center of Europe. We were traveling a lot to all those amazing European countries. And my colleagues and then my best friends were essentially people from all over the world. This is a little picture showing friends from Norway, Sweden, Iceland, Nigeria, London, Denmark, Canada, Germany. So you can imagine you have really good time and really connect with people that are still my best friends until this day. Then one of the other things that I wanted to do is to travel a little bit. And I did my 6th year of clinical rotations in Copenhagen and Prague, and this is where I met my other good friends. And basically, this is where I started to get more interested in what I want to do, what I want to specialize in. So I started to do those away rotation, and this is one of the first one that I did at UT Southwestern in plastic surgery. Basically, I graduated in 2011, and this is a picture of my best friends from Israel coming to visit me, and this is obviously the ceremony showing the group of people that were done, and then everybody sort of went through their own way, and I wanted to be able to practice in Israel. So I was doing my internship. In order to be licensed to work in medicine in Israel, you have to do the 7th year, which is essentially after 6 years of university, which is different than in the US. You do the 7th year, which is the internship. Basically, I went to the biggest hospital in Israel to get licensed. This internship is you are rotating in all the big departments, such internal medicine, surgery, pediatrics, ER, and then you have few electives. I did that in Shiva Medical Center, and this is where I met Mark. Mark was actually a general surgeon from New York who did Aliyah and went to study and went to practice medicine in Shiva. This is where I met him. And basically he said, listen, I know some people, I know that you want to practice in the US. I can maybe introduce you to my co-resident, which is now the program director at NYU, and it did so. And I found myself a year later starting this internship at NYU. It was 2013, and I landed as a SEBI during my vacation. After doing a SEBI in a general surgery rotation, they offered me a position, they offered me an interview, and I matched to general surgery, which I started July of 2013. That was a very tough year. It was the first time that I had to wear a tie to work. And it's basically the first time I started practicing medicine, real life medicine, in a very competitive place like Manhattan and NYU. And I learned a lot. This was a very difficult year for me. I was struggling a lot. It wasn't easy to learn the medical jargon and the medical practice, studying abroad, and didn't get a lot of exposure to the American system. And during that struggle, that what got me stronger. Basically, I believe that you grow through pains, and when you push yourself outside the comfort zone, this is where you get bigger and stronger and better. And this is what happened in New York. Living in New York City in a very competitive, very demanding first-year general surgery resident, also add another steps or another point in the way to make me who I am, which is more resilient. And basically, whenever you take yourself outside the comfort zone, this is where you get bigger. 7 months later, I found myself rotating in the neurosurgery department. I got a 1 month in a neurosurgery ICU, and I just fell in love. Basically, I love the ICU. I love the patient population. I love the fact that you have both surgery and emergency and medicine. And this is where I met Sean Rogers, which is actually now a pediatric neurosurgeon at Cohen's. I think he's going to give you a talk. And basically what he said, listen, I think you're going to be good. I think you're going to enjoy doing neurosurgery. I think they should really consider, trying that out. And it was a big decision to say, well, I'm leaving general surgery NYU to do something else. And this is what I did. I had to take the risk. And I took a risk and I left NYU. And 1 year later, I took a plane to Sweden. The reason I chose Sweden is because I didn't want to wait 1 year in the US to reapply for and rematch for a very competitive residency. And I had friends in Karolinska. Karolinska Institute, I don't know if you know, but this is the place that gives the Nobel Prizes each year. And it's one of the, I would say, historically legendary neurosurgical department in the world. Many of the biggest, I would say, revolutions in neurosurgery came from Karolinska. So I went there to see if I really like it, and I became a resident, or as I said, pre-residency doctor, which means that you're doing an intern job, just focusing on neurosurgery. And this is where I decided, well, this is what I want to do for sure. I love it. And then what happened is that I had to think, where do I want to do this? Where do I want to go ahead and do neurosurgery? Where is it that I want to find out my passion? Is it in the best place in the world or the place that can give you more opportunities? And I decided to go back home to have the support system that I needed, which is my family in Israel. And this is where I decided to go back to Tel Aviv and complete my residency, which was another huge decision. Am I living this beautiful, amazing Scandinavian country to go back to this very competitive and hard, residency? And I said, well, I think that you grow when you, again, move outside of your comfort zone. And this is what I did. And I took a risk, and I took this risk and said, you're going to leave this beautiful Stockholm University Hospital to another, university hospital in Israel. And then I met my other mentors, which is my chairman. And you see him here operating together on the left image. You see him here over my shoulder. I love this image because this is pretty much summarizes his mentorship. I would be, frontline operating, and he would be watching behind my shoulder, making sure that, I know what I'm doing. And residency was tough. You see on the right lower corner, I was on call for 7 years Q3, meaning every 3 days I was on call for 24 hours. This wasn't fun. This wasn't easy, but this is what it takes. If you want to become, a neurosurgeon, you have to consider this training as a high performance. This is not type of training that you do for fun. This is really something that, at least for me, I consider as high performance, same as you would want to go play sports for the Olympics or play high performance sports. You really have to consider that. And this is how hard it was. It wasn't easy at all. And as again, I turned back to this man, which was my chairman. And at one point, as a chief resident, he said, well, at one point he said, well, I think that you have a good future in neurosurgery. Where do you want to go? And then this is actually what started my more professional life and transition from training to subspecialty and attending life. And everything is, thanks to this man, which actually is my second father, I would say. Nothing would be possible without my beautiful wife, Diana. We essentially met really early in my residency and got married when I was a PGY3. And this was a big game changer. I all of a sudden had a support system. I all of a sudden had somebody that understands me, that I can talk to, that I can go home and essentially cry after all those, terrible hours and pain during call. And with her, we flew to Johns Hopkins after my chairman said that I got the Excellence Award. Every year one residents get the Excellence Resident Award, and I was awarded to go for 6 months research at Johns Hopkins. And he asked me, where do you want to go? And he handed me this book, The Special Field of Neurosurgery. It came from Johns Hopkins. It's like a 300 pages book. And I started to look at the pages: spine neurosurgery, skull-based neurosurgery, vascular, endovascular. And there was one page that got one subspecialty that got 2 pages. And that was the special field of neuroplastic surgery. Henry Brem is on the right side. This is the chairman that funded this and actually opened the door for us. And Dr. Chet Gordon and Dr. Judy Wang are my mentors from the Neuroplastic and Reconstructive Surgery Fellowship, which I'm going to talk more about tomorrow. That was a great experience to join the largest and biggest most famous neurosurgical departments in the world. And I spent almost a year there doing research about neuroplastic surgery, which I'm going to talk more about in upcoming talks. And my first daughter was born, Lenny, in Baltimore. And you see on the right side and the left side, you see one of the lab meetings. When I graduated the fellowship, I was invited to come back as a clinical fellow. After I did this almost 1 year of clinical research, they offered me to come back after I finished my chief year to be a clinical fellowship, and this is what I did. They became a family, and since it's such a small group of very specialized people, we are seeing each other in all the meetings and giving talks about our special field and what it is and what do we do. And this is some of them on the left side. This is a beautiful meeting that we had in the Craniofacial Society in Paris. On the left side, this is another talk I gave in Israel. In the middle, this is a talk I gave at Harvard Medical School about neuroplastic surgery. And again, this is all about meeting people and making new friends. I brought this field to Israel, and it hits the mainstream media about what we can do about it, what it is, new subspecialty, treating brain tumor patients and offering a more holistic approach to their care. And then I came back to Israel, and I was offered to join this basically reality TV show that followed 6 residents for 1 year during their chief year. And as I like to say, from the bedroom to the operating room, pretty much following me everywhere I go with cameras and capturing those moments as a chief resident, difficulty navigating between life and work. Then I came back to Johns Hopkins as a clinical fellow, and I did another year of neuroplastic and reconstructive surgery, working with all the amazing neurosurgeons at Hopkins. And after I was graduating, I knew that I wanted, essentially do brain tumors. So this is, the ceremony of the clinical fellowship in neuroplastic surgery at Hopkins. And this is where my other mentor came into the picture. This is Erez Nosik on the right side. He's a neurosurgeon at NYU. And I met him as a resident, and back in 2017, he told me he was a fellow at Lenox Hill, and said, come and see me operating. And I came in 2017. It's where I first met Dr. Bukvar and Dr. David Langer, and just as a student or as a resident, very very early in my training, and I met them, and this is a picture from then, same locker room that I have now, actually. And he said, well, if you want to do brain tumor surgery, come and see the people at Lenox Hill. They are very innovating, they're novel, they're doing different things than others, and I think they really fit sort of your personality. And as I said in the beginning, I look for not only good training, but also surrounding myself by good people, and I was lucky enough to get that opportunity to be a fellow here. Fellowship was absolutely incredible. Had the best time of my life, and very early after the beginning of the fellowship, I was offered to stay here, and I was offered an attending position to establish the neuroplastic program. Everything would not be possible without the group here and the people that you work with. And the reason that it's so much fun is to essentially the people, right? The people here are the ones that make this thing differently. Some of the things that I like to do. Geffen is my second-born child. She is 2 now. She was also born in Baltimore in a second fellowship. I should add a picture of that. And this is some of the things that I like to do, mostly and mainly hang out with my daughters and my wife. This is the thing that I love doing the most when I'm not at work. I also like surfing, and every vacation we try to do a surfing vacation with my wife. My wife is a very good surfer. Something that I also got into was a free diving, which is highly recommended if you haven't tried before. And again, I would like to thank my beautiful family. This is from last year, my sister's wedding. And this is my essentially my parents, and my sister's son, and my beautiful family and support system that I would not be who I am today without them. Last one thing I would like to talk about: resilience. Resilience is something that I think they should inherit, and you should have, as long as passion and perseverance when you choose neurosurgical career. And this is my grandmother when she was just 12, escaping by herself from the concentration camps. She wanted to leave. She was resilient. She had to walk 300 miles barefoot in the cold Siberian winter, and she made it. She made it to create this beautiful family, and I want to dedicate this talk to her. This is my dad when he was just 13, and this is how I think that you guys should think about your life. Passion, perseverance, and resilience will get you everywhere you want to be. There is no secret sauce here or magic pill to take. Passion, perseverance, and resilience. And obviously you have to find good mentors. All right.
Thank you so much, Dr. Ben Shalom. I mean, every time you speak, I'm just always inspired. And Nadi is truly one of the most generous human beings when it comes to mentorship and offering advice and guidance. He's taught me a lot about neuroplastic surgery and neurosurgery since joining the department. I'm not clinical, I'm a clerical, personnel, and he's just been incredible. Fadal Roba, we got some from there. I just want to, I will share his email again at the end. Is that okay with you, Dr. Ben Shalom, if we share your email address?
Absolutely. Share my email, share my Instagram, and all those social media links. I think this is a great way to follow up with people this day and age.
Yes, absolutely. I know you have to get back to clinic. I was wondering, do you have time for a few questions from our BRAINterns?
I have 5 minutes.
Okay, so one question that I think is really interesting is how did your time in the military help you now as a neurosurgeon?
I think that I think that what basically happens is that no matter where you are and no matter what type of experience you have, everything is reference experience. In the military, obviously I've been through some major, traumatic events that influence obviously my critical thinking, the way I see life, the way I see medicine, and also this is why I engage in neurosurgery. I love the trauma aspect of things. I like to deal with stressful situation, and it made me, I would say, a little bit more serious and responsible. Remember, I came from high school, which I barely studied, and all of a sudden I have to deal with this intense, very intense situations, which actually turned me into a man. And this is one of the things that I'm very grateful for my military service during that difficult times. Again, that was tough, very tough, but you only need to grow from that.
I'm on mute. We have a question about study techniques for people who struggle to stay motivated, or who have a hard time with short-term memory, and how did you overcome those challenges with your ADHD diagnosis?
All right, that's a great question. Basically, everybody, I think that one of the things that I learned in medical school is to learn how to learn, right? I wasn't a good student. And basically, I created the techniques that worked for me. I created what I call the layering technique, which I had to layer information on top of information. It worked for me. I'm a very audible person, so I like to listen to lectures. I like to listen more than see, and I like to write. And basically, with time, I developed those techniques that work for me. Some other things that you really have to think about is recovery. Every time you work hard and study hard, you need a good time for recovery. I acknowledge that. I acknowledge that I need to sleep. I acknowledge that I need to recover, and this is where I start to meditate and doing sports. You have to keep yourself physically active. Basically, I felt that the more active I am, and the more physically active I am, the more mentally strong I am to study and more concentrated I am. This is what worked for me.
And I'll just pick one more question so you can get back to your clinic. But did you have to learn different languages when you were studying in all of these different countries? And I know that you kind of touched on how you decided to choose these programs based on the actual program structure, but did also like the cultural and language barriers have any influence on your decision on where you were going to go to school?
Absolutely. I had to learn different languages, and that wasn't easy. Trust me. I came to the US, I had to learn the American medical language, which is totally new language. Then I went to Sweden, I had to study Swedish. Basically, it was fun. I liked studying. I liked to have more information. That was a better way for me to engage with patients, to engage with the cultures. And I think that language is is a heavy component to understand cultures. And I locked myself in the house when I came to Sweden for 3 months, and then I studied Swedish. That's what I did.
That's so amazing and inspiring, especially considering how many international students are joining us for this webinar. So we just want to thank you again, Dr. Ben Shalom. We know you have clinics, so you're welcome to go back to your patients. And
All right, thank you so much, guys.
Dr. Ben
Save all
Shalom
those questions for next talk. We have few talks, so I'm happy to answer more questions next talk.
Yes, Dr. Ben Shalom will be joining us again to discuss the emerging subspecialty of neuroplastic and reconstructive surgery. Thank you so much, Nadi.
Bye, guys. Thanks.
Have a great day. He's incredible. He actually is the first neurosurgeon in the world to have completed the Johns Hopkins Neuroplastic and Reconstructive Surgery Fellowship. The other doctors who completed the fellowship were plastic surgeons or craniofacial surgeons. So he's the first neurosurgeon to complete that fellowship. And thanks to Dr. Ben Shalom, here at Lenox Hill Hospital, we have established the first neuroplastic and reconstructive surgery program in New York State. And we're one of the only practices in the country that offers the specialty service to patients. And he's going to go into more detail about what neuroplastic and reconstructive surgery is during his neuroplastics talk. If you guys have questions about neuroplastic and reconstructive surgery, definitely write them down and save them for that conversation. He is amazing. I agree. We're just so grateful to have him here on our team. And I'm going to share my screen one more time. I think the links are kind of funky and weren't sharing very well from the PowerPoint slide, but I'm just going to share my screen again so you guys can take down our social media platforms. We love social media. It's a great way for us to stay connected with you and to share about educational opportunities that are happening here in person and also online. We have a Women in Neurosurgery in-person symposium coming up. We'll also have another webinar in October. And then, yeah, we just really appreciate you all for joining us today. As a reminder, all of the webinar recordings will be posted on the YouTube channel. I'll make sure to post that link one more time in the chat before I go. But again, here are our social media platforms. We'd love to stay in touch with you, and we'd love for you to share your experience during the webinar series. So feel free to tag us in your Instagram stories, any Instagram posts, you know, tweet at us, threads at us, whatever that is. We're still figuring it out. But thank you all so much for joining us. We can't wait to see you tomorrow for day 3 of BrainTerns. Thank you all so much. This is my first time doing BrainTerns as well, and I'm enjoying it just as much as you. So, oh, you're making me feel so welcome. Thank you all so much. I'm going to post those links and I'll just be quiet for a second so I can focus and post the links. So, all right, here's the Facebook group. I'm going to post the Facebook. All right. Here's the Slack. Oh, gosh, it's no longer active. Slack. Here we go. Here we go. Here's the actual link. I'm posting it in the chat. And one more time, I will share the emails from our speakers, and then I'm going to sign off. If you have any questions, you can definitely check out our BrainTerns website. My email is on there. It's hflam, F-L-A-M, at northwell.edu. We're just really grateful that you guys are here and that we have the opportunity to share our expertise with you. And we hope that this today's session has been informative and inspiring for you. Yes, I'll send you the microsite for the Women in Neurosurgery. Women in Neurosurgery webinar. I'm still sharing my screen. I can stop. Yes, I'll share that link to the microsite where past webinars have been posted. So if you're like in the webinar mood after today, you can visit our microsite and watch some webinars featuring women in neurosurgery. And there is a LinkedIn group. There is. We're on LinkedIn. I will share the URL. follow us on LinkedIn. That's where we share information about job opportunities here at Lenox Hill Hospital. So if you want to work for us, keep your eye out on our LinkedIn channels. We will share when there is an opportunity for you to join our team. Not all of the roles may be necessarily appropriate for you, depending on what type of position we're recruiting for, but that's where we share about opportunities for employment within the Northwell Health institution. All righty, we're gonna let you guys go a little early. Thank you so much, TYSM. You guys are the best. And I'm excited to see you all tomorrow. Thank you so much. I hope you have a fabulous day. Take care.